Hi, hi guys, this is Dr. Bhupesh once again from Dr. BKM Institutes. As I normally tell you what is elimination method, what are the words that you should eliminate, what are the words that you should take as a positive answer. So today we will discuss what, but today I will not teach you. Today my current batch of OET will teach you, and I will just keep writing whatever they will say. And I hope all the new students, all the YouTube followers, and everyone can understand. So, yesterday also we did the same thing. We did this elimination thing yesterday. Today we are going to revise it and then we will apply it in the listening today. Yesterday we applied this elimination method on reading, and today we will apply this elimination method in listening. So before I do that, I want to take a note of it. So please tell me, guys, what are the words we should note? Suppose if we have got four options A, B, C, and D, which are the options that I should eliminate? Which options should I eliminate? What are the words that I should
Strict words like all, constant,
uh,
mainly,
strict words like all? If any option has all, we should eliminate. Then what other words? Always,
Must.
must, must. If any option has must, should be eliminated. Again, this is 99.9%, not 100%. Please, you have to look for it. Okay, always. Then other words,
only,
only. Ly words means ly words means
LY words.
adverbs means only, exclusively, sharply, barely, hardly. Words like this that should be eliminated. Okay, what else? Everyone, everyone, everything. Because what these options do, again to revise, that this means all of the people do. All of the people have diabetes. All of the people had good effect of paracetamol. All of the people had bad effect of antibiotics. So all means all the people, 100%. So it is a very strict thing that all the people. So it normally goes for elimination. Perfect. And what other words, if you remember any ly words? Only, exclusively, always, all. What other words? And
The rarely,
rarely,
seldom,
seldom,
seldom.
commonly,
se-
commonly, sir.
frequently, have to means we have to look for these words. Commonly, usually,
Ultimately,
ultimately, can be a good word to see, because again, let's take an example of ultimately, because normally you will not find this word easily, but ultimately means that, ultimately means at last. This is ultimately the best thing. So ultimately word is like an ultimate means the best. So ultimately word should always come when it is given in the paragraph, that if I say paracetamol is the best drug, if option says paracetamol is the ultimate drug, then I will say yes, because it is the best drug. But if the paragraph says paracetamol is a better drug, and the option says paracetamol is the best drug ultimately, then I will say no, it is one of the best drugs. It's not the best drug. Means if the paragraph is saying, and the options like the best, option like uh most. So superlative degree, best, most, hardest should be eliminated as well. Because these degree, third degree, superlative degree, good, better, best. Best is the third degree, superlative. Hard, harder, hardest. Hardest is the third degree, superlative. Great, greater, greatest, much, more, most. Bad, worse, worst. This means that this is the worst thing. If somebody says, I will give you an example, paracetamol is one of the best thing, and I have got three options. A, paracetamol is good drug. Paracetamol, B option says paracetamol is better drug. And third option, I say paracetamol is the best drug. Then you should realize good means first degree. Look, second degree is better. Comparison degree, comparative degree, second degree, comparative. Comparative means that second degree is always comparison. If I say my eye has a better vision, that means it is a comparison. Automatically, my left eye has l- bad vision or less vision, because I have already said that right eye has better vision. Better means it's automatically a comparison. That is why it is known as comparative degree. If I say he is greater, ultimately means I am trying to compare that person with someone. So when you go in the paragraph, it says paracetamol is one of the best drugs. There is no comparison. Also, paracetamol is not the best drug because it is one of the best drugs. So B eliminated. D superlative degree eliminated. C, sorry. And first degree becomes the answer. That is what I want to teach. This is what reading is all about. That even though paracetamol is saying it's a good drug, becomes our answer if the paragraph says paracetamol is one of the best drugs.
Sir,
Sorry.
can you please repeat it?
Karuna ma'am, if I say Taj Mahal is one of the best wonders of the world, paragraph says Taj Mahal is one of the best wonders of the world. That means it can be at number one, it can be at number two because it's one of the best. It is not number one, it is one of the best. And my options are saying that Taj Mahal is the best wonder. Then it is eliminated because Taj Mahal is not the best, it's one of the best. So I can't put it at number one. If second option is saying paracetamol is or it is saying Taj Mahal is a better wonder, then I need to have comparison with some other wonder. But in the paragraph, there is no comparison that is given. So my answer becomes A option, paracetamol is a good drug, because when it is one of the best drugs, then at least this is certain that it is a good drug. So what I say elimination method is eliminate these two options, comparison and best, if it is not given in the paragraph. So if I see it is in the paragraph line, paracetamol is one of the best thing, so it is not the best thing, eliminated. There is no comparison given. For comparison, there should have been paracetamol is one of the best thing, and it is much, or it is better than uh, Niagara waterfalls. Oh, paracetamol ko to I have to compare with drug. It is better than ibuprofen in terms of side effect. In terms of side effect. So now I am making comparison of paracetamol with ibuprofen. If now paragraph says this thing, then I will do this comparative degree as my answer. Then this is my answer. Because paragraph also talks about comparison of paracetamol with ibuprofen. This option also talks about comparison better, second degree. So these are the degrees in English. I will tell you what are degrees: good, better, best, hot, hotter, hottest, smart, smarter, smartest. So these are the degrees. These degrees tell us about, first is good. Good means good. Better means comparison. I am better. Then automatically I am saying I am better than you, better than him, better than her. Automatically. And if I say I am the best, then I am the best. So if the option says Dr. BKM is one of the best mentors of the world, just an imagination. I'm not saying seriously. Uh, all right. I will. Yeah. So if the option says Dr. BKM is a great teacher, is a great mentor, Dr. BKM is a better mentor, and if I say Dr. BKM is the best mentor. So obviously we feel like doing option B. But in reality, Dr. BKM is one of the best, means there is no comparison. It is not the best, so there is no superlative degree, third degree. So the answer becomes this. But if I say Dr. BKM is one of the best mentors of the world, and it is certainly better than blah 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 blah, you can put your names. I'm not comparison. Again, I don't like to fall in comparisons. But anyhow, and nobody likes it. Not me. Every mentor tries his or her level best. So everybody tries his or her best. So nothing about comparison at all. But generally, but if the paragraph says it is certainly better than dash, then answer becomes this. Because my paragraph also uses a comparative degree. This is what we did yesterday in the reading as well, guys. If you remember, I don't remember that question, which I did even without doing paragraph. If we can, I will try just for a second to take you on that question with what we did yesterday. Let me take you, if it is possible, because that was something good to learn. That was reading for Tuesday, I guess, and we were doing reading for Tuesday yesterday, right?
Yes.
And we were trying to do some question randomly, and I did not read the paragraph and I did that answer for you. I will show you that same thing for you all, because that is something to learn. It just takes 2 minutes to learn things. So why not invest 2 minutes in those things? It was yesterday only.
Yes, yes.
What was the question? There was something like uh, yesterday or day before yesterday. Maybe day before yesterday. Not in this one. Not in this one. No? Like, let me take you to other thing. Yeah. Let us take to other thing. Yeah. Let's go to Monday. Maybe this will help, because that's an important thing. I know I'm taking your time, but that will teach us a lot of things if we invest that energy and time. Yeah, we were doing this hard reading. Then we were saying it's very, very hard. And then we were doing one question. I hope we can find that. If I don't, then I will let this be. No, it's not in here as well. Anyhow, so there was a question in which paragraph was using some kind of second degree. And yeah, here it is. Here it is. Here it is. So now see what is second degree. So paragraph will come more sharply. So more means, again, told you, much is the first degree, more is the second degree, most is, he is the most beautiful guy. Most means the best. He is much nice. Is much. He is more beautiful. He is more handsome. Means more means comparison. So there was second degree that was asked in the question. When I went to the option, there was only one option with second degree greater. So automatically it became my answer. Automatically, because there was no second degree. And if I do this, so this becomes my answer automatically. Because second degree, it's matching. And that is how you can do difficult questions. If by chance you are stuck in difficult questions, these kind of things they put deliberately. So this is the thing what we did yesterday. Now, which option has the maximum chance in the elimination method of being an answer? Which option can be the correct option? What are the words for the correct? What are the words for the correct?
May.
May,
Food can.
can,
Could.
possible,
Possibility.
possibility, possible. So we are talking that when we say probably means perhaps. Perhaps is also a word which we use commonly otherwise. Perhaps also means maybe. So these are the words which have more chances, because if I say paracetamol may be a better drug, then obviously this option has lot of chances, because I'm saying there is a probability. It can be better, It cannot be. So this option has more chances of being an answer. All right. So these are the things we need to look for. And let's see when we go to listening, if we can apply these fundamentals and can get things going. So yesterday we did it for reading. And today, whatever you say, guys, again, I'm not, Dr. BKM is not the one who creates question papers. Thankful to all the institutes of the world who create these wonderful question papers. I am here to help you with how to do OET answers. So yeah, here I am. So please tell me any OET listening that you would like me to do. Any OET listening. Name of the patient.
Sir, today's Brian Harris. I got only 5 in A part.
It doesn't matter, ma'am, again. Just which brand? But I want to do listening part C for the elimination method for now, ma'am.
Okay,
Just
sir.
think of the day. Any
Okay, sir.
patient's name?
Sir, Benedito, maybe yesterday's one.
Benna.
Dito, something like that.
Then you're not.
Let me.
Chirag sir, you have to keep it mute, please.
Bernardito.
Bernardito.
Can you
Bernardito.
can you spell it for me?
BER
Hmm. Okay.
NAR
Okay.
DITO.
Yeah, got it. So this is the one that you want me to do. Okay. So this is the listening.
Yes.
Because part C, this
It's been really useful. Thank you.
this seems like very easy. I don't know why to do this thing. But I will take the other one because these are very small words.
Yes, sir, this is very easy.
Yeah, but in this there are no rules of English I can teach you. Any other listening, please? Any other listening, please?
सर टुडे वाली जो है आज वाली
Let's take today's. What's the name?
सर पार्ट ए वाज रेस्टलेस नाइट डिटेल्स ऑफ वीकेंड समथिंग
Patient's name. Patient's name.
health professional is talking to the
Mr.
husband of a patient.
Brian Harris.
Yeah, better.
Brian Harris.
Yeah, there you go. And I will take part B and C because I want to have some English rules applicable because I am here to teach you that method where we can find it easily. So let's say this.
Perfect extract 2. Questions 37 to 42.
Mm,
You hear the monologue of a physician giving a lecture on ankle fractures. You have 90 seconds to read questions 37 to 40.
so now I don't have much, even in this, not much of English is used, but I can see lateral malleus fractures involve only tibia. Now we have words like an isolated mallear fracture is very rare compared with an. So in this case, again, there are two things that are given as a part of English that involve only tibia. So if that involves anything other than tibia, then it becomes my answer. Then it goes under elimination. That if it says lateral malleus fractures involve tibia and dash, then it is out, eliminated. Isolated lateral malleus fracture is very rare. Compare with an isolated medial. So these are the two words. So there is comparison given. So let's see and listen to this question number 38 to make this kind of a rule applicable. Let's see how it goes. Yeah. I'm just going to play it.
Based on the location and severity of the injury. When a broken ankle occurs, the injury may be to the end of the medial malleolus, called tibia, or to the lateral malleolus.
Types of ankle fractures.
There are different types of ankle fractures, and treatments vary significantly based on the location and severity of the injury. When a broken ankle occurs, the injury may be to the end of the medial malleolus, called tibia, or to the lateral malleolus, called or both. There are many types of ankle fractures, and let me explain you about certain common types ankle
Let's take it from
fractures.
the start because I'm unable to get it from the middle. So I'm just going to take it. From 37.
Types of ankle fractures.
Okay, starting from here only. A surgery will be required in lateral malleus fracture if. My question says,
Hello, doctor. What are the types of ankle fractures?
There are different types of ankle fractures, and treatments vary significantly based on the location and severity of the injury. When a broken ankle occurs, the injury may be to the end of the medial malleolus, called tibia, or to the lateral malleolus, called or both. There are many types of ankle fractures, and let me explain you about certain common types ankle fractures.
if I can read the question number 1, any option that is a strict option, generally asking. Any option, if I can find a strict word that I normally say is a strict word. Which is the
Only,
most
sir.
in question number 37. In question number 37.
Within 4 centimeter of the end of bone.
Thank you very much, Karuna ma'am. So this is the word that is strict word. Within 4 centimeters. That means it has to be, it cannot be 4 centimeters. It has to be within 4 centimeters. It cannot be more than 4 centimeters at all. And the second, if I can figure out inner part of the ankle is injured. So if there is any other part rather than inner part, it is the second strict option. And third option says fracture involves lateral malleolus. That means it involves lateral malleolus, but it can involve other things too. C is the most lenient option. I am not saying C is the answer, but generally saying how do you identify strict and not strict option. A is very strict, within. If the speaker says within, then this is my answer. If it says more than 5, over 5, around 5, approximately 5, then this option is gone. Around means it can be more than 5. Approximately or around means it can be more than 4. Approximately means it can be more than 4. So A option stands only if he says it is less than 4. B option stands in case if it says only inner part is injured. And C option says it involves, that means it can involve other things too. It can involve A, B, C, D. One of the thing is lateral malleus. So C is the most lenient option. But let's see how it is applicable. Let's see.
Different types of ankle fractures, and treatments vary significantly based on the location and severity of the injury. When a broken ankle occurs, the injury may be to the end of the medial malleolus, called tibia, or to the lateral malleolus, called or both. There are many types of ankle fractures, and let me explain you about certain common types ankle fractures. Lateral malleolus fractures is the ankle fracture that involves...
Now, this is where you should know where to focus more. Focus should be more when the person is talking about. My question says a surgery. My keyword is surgery. My second keyword is lateral malleolus fracture. So surgery is required if, and the second word is lateral malleolus. So now he just started speaking about lateral malleolus. Listen again.
Lateral malleolus fractures is the ankle fracture that involves only fibula. Most of the lateral malleolus fractures can be treated without surgery if the ankle...
Now he's talking about surgery. So both of my keywords have come. Now I will pay more attention.
...remains stable. A surgery is recommended in case of an unstable joint or the ligaments are damaged. However, the hint for surgical recommendation is when the fibular fracture is within 4 centimeters of the end of the bone. In such case...
This is like an easy answer and he spoke exactly the same words. So A should be the answer because he has spoken the words within 4 centimeters. Again, let's listen.
It's when unstable joints or the ligaments are damaged. However, the hint for surgical recommendation is when the fibular fracture is within 4 centimeters of the end of the bone. In such case, the fracture can be treated non-surgically if there is no injury on the inner part of the ankle. Medial malleolus fracture.
A surgery can be avoided or surgery can be done?
If there is no injury on the inner part of the ankle.
Sorry.
Is when the fibular fracture is within 4 centimeters of the end of the bone. In such case, the fracture can be treated non-surgically if there is no injury on the inner part of the ankle.
Now, again, he has changed. This is what I say. That is why we face so much of trouble in listening. I was saying A is my answer, but now I feel A is not my answer. Why? Because he is saying surgery is recommended. There is difference between recommendation and requirement. Requirement means necessity. So now if you will listen to this question nicely, again A was a strict option. So he said a surgery will be recommended. A surgery will be recommended if the fibula fracture is within 4 centimeters of the end of the bone, but it can be treated non-surgically. That is what he said, as far as I think. And then he said surgery is required when the inner part of the ankle is there. So B becomes my answer. I will listen to it again. I'm not sure because that is what, again, we had this recording with Navjot ma'am. She exactly said you are never sure what is right and what is wrong. You keep trying.
However, the hint for surgical recommendation is when the fibula fracture
Recommendation is
is within 4 centimeters of the end of the bone. In such case, the fracture can be treated
in such case means A option, fracture can be treated non-surgically.
if there is no injury on the inner part of the ankle.
So that means if there is no injury on the inner part of ankle. But if there is inner part of the ankle that is injured, that means that is where the surgery is required. Let's see.
Medial malleolus fractures involves only tibia. This fracture occurs to the bone on the end of the tibia, which is called the medial malleolus. An isolated medial malleolus fracture is very rare compared.
Okay, B becomes my answer because again, it was supposed to be A because he spoke exactly. That is where we get lost. I hope B should be my answer. I will try to say it. Sorry, I'm taking to the answers first. Normally, again, I don't do that, but I want to stop recording here only because I don't want to make this recording lengthy. 37th B. That is what I did. Again, I'm teaching you. That is what happens in exam. That is why you are unable to get that listening thing. Because he said a surgery will be recommended if the fibral fractures. In such cases, it can be treated non-surgically if inner part is not injured. That means if inner part is injured, then surgery is 100% required. Again, listen to it. That is where you will learn. I'm here to guide you.
Based on the location and severity of the injury. When a broken ankle occurs, the injury may be to the end of the medial malleolus, called tibia, or to the lateral malleolus, called or both. There are many types of ankle fractures, and let me explain you about certain common types ankle fractures. Lateral malleolus fractures is the ankle fracture that involves only fibula. Most of the lateral malleolus fractures can be treated without surgery.
So again, that is where my keywords come into action. I pay attention. My both keywords are here now. My concentration should be double now.
Ankle joint remains stable. A surgery is recommended in case of an unstable joint or the ligaments are damaged. However, the hint for surgical recommendation is when the fibula fracture is within 4 centimeters of the end of the bone. In such case, the fracture can be treated non-surgically if there is no injury on the inner part of the ankle.
If there is no surgery on the inner part of the ankle, that means if there is surgery, if the surgery is required if there is anything on the inner part. That is how it becomes my answer. One more question before we leave for the day.
Medial malleolus fractures involves only tibia. This fracture occurs to the bone on the end of the tibia, which is called the medial malleolus. An isolated medial malleolus fracture is very rare compared with an isolated lateral
So I don't think so A is my answer, but generally saying medial malleolus is also called tibia. I don't think so it is saying so. Medial malleolus and lateral malleolus fracture involved only tibia. We have just listened that lateral malleolus fractures involve fibula. We did over here. So anyhow, this option is anyhow wrong. Generally saying, because tibia was medial fracture. It was said in the statement early only. So if you are listening to things carefully, you do questions with complete sense and authority. Again, let's listen.
Medial malleolus fractures involves only tibia. This fracture occurs to the...
So here the words are changed. Medial malleolus fractures involve only tibia. So all the words are same. elimination happened because he said medial malleolus fracture involves only tibia, not the lateral. So that is what I say is elimination. You eliminate your options. Now let's see the other one.
The end of the tibia, which is called the medial malleolus. An isolated medial malleolus fracture is very rare compared with an isolated lateral malleolus.
So an isolated medial malleolus fracture is very rare. So he has opposed the option. So now this becomes my answer, which I was not thinking should be an answer. Because elimination is easy. Again, let's listen to it. Again, see elimination.
In such case, the fracture can be treated non-surgically if there is no injury on the inner part of the ankle. Medial malleolus fractures involves only tibia. This fracture occurs to the
Medial malleolus fracture eliminated. B option is eliminated.
The end of the tibia, which is called the medial malleolus. An isolated medial malleolus fracture is very rare compared with an isolated lateral malleolus fracture.
So the words have been shuffled in the option C. So A, which was not spoken, becomes my answer because I eliminate B and C. So 38th should be A. Let me check. Yeah. So that is what is known as elimination. When you will keep on trying to find the right answer, it will become difficult. When you will just listen to the words, you will see that the words have been shuffled, that the medial is given first and lateral is given second. What happened in the C option, and they changed the words in the B option. So A become my answer. Why should I bother what A says or not? And B is not my answer, C is not my answer, I don't care what A says. Then A becomes my answer. I don't have to use my brain or overthink about this thing. Because my B is not my answer, C is not my answer, I have three options, A is my answer. This is what is known as elimination. This is Dr. Bhupesh from Dr. B.K. Mohit Institute, again telling you, it's not at all difficult. It is the easiest exam that you will ever take in your life. Thank you. We'll see you tomorrow. Thank you very much.